Good afternoon and welcome to today's Made by McGill alumni webcast, where we will explore the state of the COVID-19 pandemic and discuss whether the world is any more prepared now to deal with future health emergencies. My name is Derek Hassoff, Managing Director of Communications at McGill's Office of University Advancement, and it's Thursday, May 27th, 2021. As the world continues to battle COVID-19 and take stock of the soaring human economic and psychological tolls, global health experts have already begun analyzing what went right and what went wrong, and what issues we ought to be thinking about before the next pandemic arrives. Joining me today are two of McGill and the world's leading experts on global health, infectious diseases, and pandemic preparedness. Dr. Tim Evans is a familiar face to anyone who has tuned into some of our earlier webcasts. He is the director of McGill's School of Population and Global Health in the Faculty of Medicine and Health Sciences, former Assistant Director General of the World Health Organization, and Executive Director of the COVID-19 Immunity Task Force. Welcome back, Dr. Evans. It's great to see you.
Thanks, Derek.
Great. And we have with us Dr. Joanne Liu, who's a McGill graduate, emergency room physician, and former international president of Médecins, Sans Frontières, Doctors Without Borders, from where she spearheaded the global response to the Ebola outbreak in 2014. Earlier this month, it was announced that she was joining McGill as a professor of practice focusing on pandemic preparedness and health emergencies. Dr. Liu is also one of several international experts on the Independent Panel for Pandemic Preparedness and Response, a multinational group led by the former presidents of Ireland and Liberia, which issued what has been referred to by some as a damning verdict on the global response to the coronavirus. The panel pointed out 13 mistakes that turned a small outbreak into the devastating pandemic that has claimed hundreds of thousands of lives and upended healthcare systems, economies, and societies around the world. I also did want to mention that earlier this week, incorrect information was sent to some of our viewers suggesting that Claude Genereux, one of the co-chairs of our Made by McGill fundraising campaign, would be joining us for the beginning of this webcast. Unfortunately, that information was shared in error, but I do want to take this opportunity to recognize Claude for the enormous energy and dedication he pours into McGill week after week in support of our campaign and so many other initiatives here at his alma mater. Thank you, Claude. And before we jump into today's conversation, a reminder that if you're watching live and you have questions for our panelists, please send them to us by email at aoc@mcgill.ca, and we'll do our best to address them to our guests. So let's begin. Dr. Liu, first off, thank you for representing Canada on this international panel that I referred to, and of course for joining us today to share some of your insight and expertise with our McGill community, and welcome back to McGill. So let's begin with the panel's findings. One media report described the work as an indictment on an international health system that was, quote, clearly unfit to prevent the pandemic and needs radical reforms to avoid similar mistakes in the future, unquote. Can you provide us with an overview of some of the panel's gravest concerns, perhaps focusing on those that were at the root of the outbreak in early 2020?
Well, thank you very much, and good day, everybody. I think the panel, what was pretty clear and of no surprise is in our term of reference, what we had to look at is learning from the past pandemic, looking at what happened in this one, and coming with recommendation for the future. But and this is what we did. And when we look at the past, is basically if we would have applied all the recommendation that we had from the 11th panel and commission on pandemic preparedness, we probably would have fared better. But the reality is less than 10% of those recommendations were implemented. So A, we didn't learn from the past. B, we were not ready, and that's an euphemism. And three, we lost time. We lost, I would say, very, very precious time at the beginning of this epidemic that became a pandemic. Initially, in terms of the detection in China, and in applying what we call the principle of the precautionary principle, meaning that when you don't know, you are being very cautious. And then it was pretty clear at the outset that human-to-human transmission was most likely happening. And it should, the precautionary principle should have been applied and should have been transmitted as early as possible. The second thing is where we've lost precious time is as well in terms of declaring the public health emergency of international concern. But these are only a few days that we've lost, and everybody are making a big deal out of that. But where we've lost the most time is really in the month of February after the declaration of the public health emergency of international concern, is except for a few handful of countries in Southeast Asia, the rest of the world sat on their hands for several weeks, from 4 to 6 weeks, doing nothing, wondering if it's going to come their way. And this is where we have lost, I would say, the key opportunity to basically tame the epidemic to not become a pandemic.
Right. So I know Dr. Evans, I'm sure, is going to want to jump in on that. But before we let him do that, I do want to just go back to that point about lost time, because what I found interesting was the report referred specifically to the month of February of 2020 as being a lost month in terms of the world's response. So can you explain, I mean, we kind of know what happened, but what should have happened last February that proved to be so consequential in the trajectory of the pandemic? Dr. Liu?
For Tim?
Yeah,
oh,
no.
Okay, I thought it was for Tim.
Oh.
What we should have done? Well, I think that was what some of the countries in Southeast Asia have done is just gearing up in terms of responding, and it was in terms of do we have the tools and resources to respond, and then many countries didn't even look into what do we have in our stockpiles, how we prepare, do we have the right standard of operation to implement, and instead it's been more like, should we have a spring break or not? Should we go to Florida and have a good volleyball game? These were more the concern than saying, are we ready? Is our staff ready? Do we have the resources? And then in addition is, should we do more in terms of protection worldwide? And that did not happen.
Okay. Now, Dr. Evans, it's interesting because February of 2020, I was checking back on our notes. That was actually the date of our very first coronavirus webcast where we featured you and some of your insight. And I remember you did provide some ominous warnings to our audience at the time about what might happen. And I'm sure that you and others shared these concerns with international governments. So why do you think the world was caught off guard by what was about to come?
Well, Derek, it's nice that you're overlooking our conversation about beach volleyball. So I'm delighted that you didn't mention that. But I do think the issue of the lost month is a very catchy entry point to looking at why every second and every hour and minute and hour is absolutely so critical, particularly at the early stage of an epidemic that has pandemic potential. And the signals were abundantly clear, not only from China, but also some of the early cases that we saw in Canada coming from Iran, which were arriving in Vancouver, Toronto, and Montreal, where this was very much global. And instead of jumping on this with a standing army, we were very much on the back heel. And I think Canada was not alone. I think many other countries were sitting and watching and waiting and hoping that perhaps this was not going to be the threat that in retrospect, we can all see it clearly was. But I think what's really important from the panel's report is public health doesn't have the luxury, especially in the early days of a threat, to watch and wait. I think what's really critical is you have to have a standing army that's ready to spring into action. And so if you look at the Auditor General's report yesterday that looked at the management of PPE supply, protective equipment, which we know was an issue early on, the mismanagement of that is not in the month of February. It's a decade-long problem that wasn't addressed. And I think this issue of how you keep your public health agencies ready to spring, having that standing army ready to move into action with all of the ancillary logistic and supplies that are necessary, is something that Canada appears not to have managed well, and certainly other countries. So to me, I think to get even a better assessment of this, we should really undertake a similar sort of exercise on the Canadian level, which would be sort of a similar independent panel on pandemic preparedness and response for Canada. and look in detail as to where we were flat-footed instead of really being on top of this and exercising the precautionary principles Joanne eloquently laid out.
Great. Well, thanks. Now, Dr. Liu, I know you've worked on the front lines of many of these infectious diseases, Ebola and others during your career. I mean, I know we as the general public that doesn't sort of live in the world of infectious disease and pandemics, I mean, we've sort of, had these scares, SARS, H1N1, MERS, but they always seem to just be scares that go away. Do you think that we, the world, we're just lulled into a sense of safety that, oh, this is just another one of those infections that's going to just disappear?
Yes, great question. And I think that, yes, we like to be scared, but we like to forget. And yeah, it's just like when we go and see like a horror picture movie. We love to be scared, but we forget about it. That would be dramatic. That would be what I call the double fault, because I think the first fault we had collectively is not being prepared. The second fault would be not to fix the system to be better prepared next time around. And as Tim is saying, to be standing ready to act, to respond. So, and my humanitarian heart, what is saying to that is, when was the last time that we lost, more than 3.5 million life worldwide? When was the last time that the world ceased to be the world together for 14 months? When was the last time that, I don't know, that we have a loved one who ended up dying alone? When was the last time that here in Quebec, some of our elderly died of hunger and thirst? Didn't even happen at the peak of Ebola in 2014. If this is not enough, then let's go for the financial. And then Tim's going to help me because he works at the World Bank. But when was the last time that we have a lost GDP of 20 trillion over 1 year? 10 trillion over 1 year, 22 trillion, that is forecasted for 2025 and even more. When was the last time? I don't know. So for me, if it's not now, I wonder when it will be. But this is why the independent panel is calling to elevate the threat of pandemic to the threat of other existential threat, like chemical weapon, like nuclear accident, where basically when it happens, we do understand the highest level of the leadership of a country needs to pay attention. It's head of state, but it's multi-sectorial response, meaning that it's financial, it's domestic, it's defense. It's not like a technical health issue. It's far beyond that. And I do hope that it's more than a wake-up call. We need to stay awake.
So let me ask you this next question, Dr. Evans. I'm jumping around a bit with my own notes, but you talked about being prepared for the next pandemic. I mean, there are still a lot of people in the world today who look at this current, COVID situation as, a once in a lifetime or a once in a century occurrence, and are perhaps taking comfort in assuming that the next time the world is dealt with a pandemic, it will happen after we've all sort of passed on. Is that something reassuring, or, has the planet enter the phase of life where these sorts of viral outbreaks are perhaps going to become more frequent and we just need to be constantly on guard against them?
Well, I think Joanne mentioned early on that we're in a situation in terms of planetary health where the density of activity is bringing us into much closer contact with animal reservoirs, where you see jumps between the animal infections to human infections, perhaps happening more frequently. So I think there's a very strong hypothesis that with climate change, and also just with the extent to which we manage global resources to meet our consumption needs, that we're putting pressure on the environment in such a way that we're accelerating the likelihood of these sorts of outbreaks. So I don't think, or I put it this way, it would be a massive mistake to think somehow we can file away this when it's over. And let me remind everybody, we're not through this pandemic. at all. All right, so we've still got a ways to go, and hopefully we'll get back to that, Derek. But just to say, it would be a huge mistake of history not to learn these lessons and put in systems now, which even if they don't get called on for a century, are going to make sure that in a century we still have that institutional memory and that capability that is going to avoid this being the crisis of the cataclysmic proportions that it's been, both for the world as a whole, but also, as Joanne, I think, pointed out, for our own sense of dignity and integrity and fairness with respect to individuals and households.
Okay, great, thank you. And I do want to get shortly to some of the questions around the current situation, and before we, of course, jump to the next pandemic, dealing with this one. But before I do that, maybe I'll direct the next question to you, Dr. Liu. So I understand that the WHO's 74th Annual World Health Assembly is actually taking place online this week and next. And as you would expect, the theme this year is ending this pandemic, preventing the next. Has anything constructive emerged from these discussions that provide you some hope that maybe the world has learned its lesson?
Derek, maybe I can just jump in before Joanne answers. The reminder that I worked for the World Health Organization once, so she could be charitable, please.
She's smiling.
I'm always charitable. That's part of me. I think that it's a bit too early to see what will come up for the World Health Assembly. On the other hand, I must admit that the general director has been very, very strong in terms of his statements with respect to the world stockpiles of vaccine and the necessity to redistribute the vaccine now. And he basically called upon the high-income country, the rich high-income country, who have reached some adequate level of vaccination to share right now, instead of basically continuing to vaccinate, immunize a group that are at much less risk, like the teenager from 12 to 18, which is a very, very, I would say, touchy, hot potato topic. So I think it was, I would say, quite courageous to say that, because it's putting himself a bit in tension with different member states. But I think it sets the tone in terms of basically calling it as it is, and then giving a sense of urgency that if it is not happening now, it might be too late, or it would be much harder to catch up in terms of having a virus that is running loose around the planet and that is mutating itself and might come back in a few months down the road in a new shape that might escape the vaccine that we are actually using right now. It's I don't want to be like the party pooper, but this is part of the possibilities. So I think it sets the tone. On the other end, my biggest issue and my biggest worry would be that they and what we are hearing right now is they plan to have a working group on COVID-19. And you know what? That's often a bad news. But Tim, over to you.
Yeah, so I do want to, and I do want to get back to the issue of vaccine access and equity shortly. But I did actually have a follow-up question for you, Tim. So I know in parallel to these, the assembly this week, there's actually been discussions mainly coming out of Europe that I've read about the need to establish an international treaty on pandemic prevention and preparedness. And some are comparing this to the movement to establish the United Nations in the immediate aftermath of World War II. So I guess my question to you is, does this idea make sense? And doesn't the WHO already serve this purpose? Or are what we're asking for is a WHO with more teeth and more authority?
So I think it's a great question. And this was actually, I think, part of the discussions at the World Health Assembly this week. I think one of the things to recognize is that the World Health Organization has something called the International Health Regulations, which are a treaty and are designed to have an alignment across countries in terms of reporting and reacting to outbreak pathogens that have potential for have pandemic potential. So we do have something in place. After SARS in 2003, 2004, there was a move to revise those international health regulations. That process took about 3 years in total. And so the idea of a treaty is not necessarily a bad one, but it's something that will take time because you have to negotiate agreement across 194 member states. I think the idea of having an international treaty, though, recognizes a little bit, as Joanne was saying, that this is not strictly limited to the health space, meaning the need for actors in other sectors to be part of this, and particularly political leadership at the level of head of state, is extremely important to a treaty like this being taken up and getting the buy-in that I think people feel is necessary to put us on the right trajectory to move to much greater preparedness and readiness. I think it's necessary, but not by any means sufficient. And so I think, yes, these are important parts of the response. And just as the panel's report had a number of recommendations, there are other complementary activities that need to take place alongside so that one is not putting all their eggs in a treaty basket.
Mm-hmm. Okay, so let's, I was going to say fast forward, but I guess rewind perhaps is a better verb to the current situation that we're in right now. Before I do, just a reminder, if anyone is watching live and has any questions for Dr. Evans or Dr. Liu, you can send them in to us by email at aoc@mcgill.ca. But Dr. Evans, maybe I'll stick with you to start this next segment, which is really to get your perspective on where things do stand today here in Canada. You referenced earlier, the pandemic is not over, clearly. Are you encouraged by the speed with which infection rates and hospitalizations are falling across Canada right now, and by how quickly the population is being vaccinated? And does this mean that the pandemic, at least in Canada, and all the crippling public health restrictions we've been living with for so long might finally be coming to an end?
Well, Derek, I think it's the short answer is it's too early to tell. If you had asked me this question just 6 weeks ago, I would have said we're headed into Armageddon. We were headed into a third wave. We had testing positivity rates across the country, which were extremely elevated, double digit, and vaccination coverage was still very low and not picking up satisfactorily. We're fast forward 6 or 7 weeks, and we've seen, I think we have 60% of Canadians with 1 dose at the moment, and 5% with 2 doses. And we've seen, very encouragingly, the number of acute infections drop on a daily basis, virtually everywhere except Manitoba. And although it's coming in the right direction, I think. But I think most importantly, hospitalizations and deaths are much lower as well. So I think the opportunity of the vaccines is one that no country can squander. It is an absolutely essential part of getting us out of it. And I'm delighted to see that Canada is moving with speed on this front. I think this reflects good policy. Back a year ago, or almost a year ago, when Canada developed advanced purchase agreements with vaccine manufacturers that didn't even have proven products. And that was a risk, but it's a risk that has paid off well in terms of there not being a supply constraint at the moment. And that's important because we are facing variants. In particular, the B.1.617.2, which is associated with India. And there's some suggestion that the single dose may not be as effective and that we may therefore need to accelerate and change the policy from a 16-week dose interval to something shorter to make sure that we don't have a further flare from variants. So I think overall, we're in a very good situation from a national perspective. But international, we have to recognize that it doesn't serve Canada well to simply immunize its population if vast tracts of the rest of the world have virtually no vaccine coverage. And in this regard, I think Canada needs to take a much more explicit leadership role in promoting vaccine equity or access to vaccines for every person everywhere. And I was hoping we'd see something at the World Health Assembly this week, but I think this is an area where Canada needs to really walk the talk on being back on the international scene, rather than being accused of turning its back in a moment of enormous need.
Okay, so on that point, I do want to ask you, Dr. Liu, for your perspective on sort of the global state of affairs around COVID right now. So clearly things are looking up here in Quebec and in Canada, but we're obviously seeing really troubling signs and trends in places like India, like many parts of Latin America. Can you speak to your concerns as you watch these events unfold in these hotspots around the world, and explain to us why those of us here in North America, Europe, and elsewhere ought to be paying close attention to what's happening?
I think that what we see unfolding right now in different parts of the world, India, Nepal, Brazil, part of Africa, Yemen right now, it's dramatic. It's a tragedy. And it's even more tragedy knowing that of all the tools that we have developed over the last few months, and saying that depending on where you're born, then you don't have access to it. And then right now, as you know, we are celebrating here a great coverage of Canadians being immunized. In Africa, it's less than 2% of the population in the African continent have got their first dose of vaccination. So that's basically completely appalling. So I think that we have, I would say, a duty to help and care, and there's the moral imperative to do it, and there's the pragmatic utilitarian reason to do it. As I said before, it's just if we let the virus loose, moving around, then it will transmit, it will mutate, and this might be problematic down the road. So, and escape some of the vaccine that we have here. So that's one thing. But the other thing is the fact that we are so interconnected and interdependent in a very complex way. For example, we know that India is basically the pharmacy of the world. It produces 20% of the generic medicine for the world. It produces 80% of the vaccine for the world. Not having a healthy India producing what they are supposed to produce is putting everybody's people health at risk, even here in Canada. So for me, I call for solidarity and then for the moral imperative, but there is a very pragmatic utilitarian, I would say, argument, which is if we're not protected everywhere in fully, eventually in a near future, then we're going to put all ourselves at risk again. And so I do hope, and I will just echo and finish that yes, I have a lot of ambition for my country, Canada. And I do believe that Canada needs to walk the talk in terms of taking leadership on the global health landscape. And I think that it's not tenable anymore that it's sitting on the fence. It's not tenable that it's sitting on the fence on the fact that it's wondering if it's going to share its surplus. We know we're going to have surplus. We should commit that we're going to share it, and going to share it in an equitable way. We should stop, sitting on the fence on intellectual property, and then just say, for product of COVID-19 to fight COVID-19, there should be a waiver, or we should allow compulsory licensing for intellectual property. We should as well help and promote capacity to product vaccine, because we might be in the next few months in the reality that we probably need a booster, maybe a third dose possibly, or if it becomes endemic, we might need to vaccinate the whole planet every 12 or 18 months. So it is in our interest, even if we don't want to do it in the world interest, to get vaccinated at a much wider scale around the globe.
Now, Dr. Evans, I doubt you're going to disagree with anything that Dr. Liu just suggested around vaccine access, global vaccine access, but how do we convince Canadians or the Canadian government to give up some of their precious supply of vaccines to help others? Or is it really looking at moves like the Biden administration announced recently about intellectual property and making it easier for countries to create and produce their own domestic supplies? I mean, what are the easy answers here?
Well, thanks. Of course, I was instructed by Joanne earlier not to disagree with her, so I'm following suit. But I think she makes a pretty compelling case that it's not only the right thing to do, it's in our self-interest and things. But the specifics, I think, are important. First, I think advanced purchasing agreements were responsible for giving important signals to industry to ramp up production at a time when they wouldn't have without an approved product. And so that, I think, was a good policy. I think the following on that, if we've got not only good vaccine coverage, but we've got very low rates of transmission in Canada, then the relative benefit of vaccines that we have procured but are not deploying immediately because we don't need boosters and we've got good coverage, have a huge upside if they're effectively deployed to other countries that have low rates. That's smart. That's smart for Canada, and that's smart for those countries that would be recipients. And they're already paid for. So to me, that's a no-brainer. More fundamentally, I think the issue of moving towards a global vaccine capacity, which has production capability of 10 to 15 billion doses per year, is essential for the survival of the human race. And so we should be putting in place the conditions that would allow not only that production capacity to exist and to be sustained and updated, but secondly, that we look at the conditions that would facilitate that and work to create those conditions. Now, if that means making in the short term provisions that are already agreed in the Doha Agreement on World Trade of the World Trade Organization on intellectual property with respect to public health emergencies, well, we should act on those. That's why they were put there. But we also know that it makes sense for a continent like Africa that has 1 billion people at the moment and will have 4 billion people by the end of the century to have its own vaccine production capacity. And from a foreign policy perspective, it would be brilliant if Canada saw Africa as perhaps the most important market in the world and supported the development of their continental economic growth by contributing to the development of vaccine and essential medicine production capacity on that continent. So these are things that I think looking forward are really in Canada's interests. And this is why I think it's so important for our leaders to come out and really be leaders on this front, because the absence of a particular plan puts us in the backseat and suggests actually we're part of the problem rather than being part of the solution.
Great, well said. And just to give our viewers a bit of a sense of the scope of the issue or around vaccine equity, I did pull up a few statistics earlier this morning in terms of vaccine distribution. So in North America, there have been 56 doses administered per 100 people. And in Europe, it's 41 doses per 100. Asia is at 17 doses per 100 people. And as Dr. Liu mentioned, in Africa, they're not even at 2 doses administered per 100 population. So clearly some gaps there. I was going to get to see some of the questions from our viewers later on, but one has just come in. Maybe I'll stick with you, Dr. Evans, because specifically on vaccine supply. It came to us from Amia Benegal. So she writes that Canada was slow with vaccine rollout since it does not have its own manufacturing capabilities. Post-COVID, how can Canada improve its manufacturing capabilities?
Great. So thanks to Amea on that. And I think there are already some plans underway. The federal government announced $200 million, I think, last week for supporting specific efforts. We have very encouraging news from Medicago, based out of Quebec City, with respect to phase 2 vaccines. And so I think there's some very good work that's starting to make sure that we have a capable and a vital vaccine capacity in Canada. I think, however, part of the challenge beyond the immediate crisis will be to sustain that manufacturing capacity. And it is possible that we may find that we move to a situation in 4 or 5 years where there's a bit of oversupply. And so I think we have to be smart about how to sustain these assets over time, particularly in the setting where they may not be as many demands for production at scale. So I don't have a magic solution for that, other than I think we should be working on those sustainability strategies now, so that we don't have a situation where we've got a vaccine manufacturing capacity popping up now and then folding because it can't sustain itself economically.
Mm-hmm. I don't know if you know Amia personally. She's just sent in a couple more questions, and it feels like she's almost reading the script over my back, because they're exactly some of the questions which I'm hoping to address if we have more time. So thank you, Amia, for that question. I'll try to get to a couple more of yours. In the meantime, if anyone else has questions, it's aoc@mcgill.ca. Before we leave the issue of vaccines, I do want to just bring up the issue of vaccine hesitancy. We actually, our last webcast that we ran in April was specifically around that issue. And I know it's become an issue, maybe less so in Canada, but certainly other parts of the world, including the United States. So how large a concern is vaccine hesitancy if we are to achieve that magic herd immunity that we've been talking about for so long? I don't know which one of you wants to take that one on.
Joanne looks like she's writing on this, and so I'll let her formulate her thought, and I'll give you something superficial in the interim. I think it's extremely important. On the one hand, however, the latest poll results in Canada show much better uptake than anticipated, especially relative to poll results 3 or 4 months ago. So I think what we're finding with the further evidence of the benefits of vaccines, the hesitancy is fading to a certain degree, particularly in Canada. I don't think that's the case in the United States. And I think there are 2 dimensions of hesitancy that we need to be very sensitive to. First is the population who believe that vaccines were produced too quickly and haven't had time to be thoroughly scrutinized, and therefore they're skeptical of the science. And that is one group. But a second group that I don't think has had enough attention, and is particularly important as we begin to open up, are the people who will feel, well, 1 dose was sufficient, and therefore I really don't need a second dose. And I think that delay or that sense of security may also challenge and undermine the degree to which we not only achieve but sustain thresholds that will limit the spread of the pandemic, which is what I define by herd immunity. So I think we're in the right direction. I'm very encouraged by what's happening in Canada at the moment. But I do think on both of those fronts related to people who are hesitant all along, but those who may be perhaps forgetful or not see the second dose as important, I think we have to pay particular attention to that population.
Okay. Dr. Liu, any thoughts you want to add on this whole notion of vaccine hesitancy and people just not understanding the importance of getting inoculated?
I love this topic, actually, vaccine hesitancy, because I think that people have the right to hesitate and have the right to ask questions. And I think that we should not take for granted that people would just go for it. And I enjoy actually answering those questions because I think that it's a way to engage with people. I've received so many emails and so many phone calls on my hospital asking from nurses, from elderly, from other colleagues, should I get vaccinated? And initially at the outset in my hospital, they were like 40% were hesitating. We're probably going to get a much better rate. But the thing is, because we didn't take the time to explain why it was valuable. And the thing is, we need to accept that people will get vaccinated for several reasons. Not only because they want to get protected, but it could be because they want to go back and see a Genesis show at the Centre Bell, in November. Or it could be because they want to have dinner with their grandma. But it's not about, being protected, and we need to accept that. And then some different people are studying that, but it's quite striking to see that the motivation to get vaccinated is very multifactorial. We need to accept that. And we need as well to respond to people in a way that is as well respecting and identifying as well their position and not demonizing them. And I think that in Canada, we as well manage to not politicize too much the issue about vaccine hesitancy, meaning that in some countries, it gives you, a hint of where you are voting. So we're not there at least, and it's good. But I think that us as people having the that can be on the spotlight, can explain things. We have to embrace the fact that people are hesitant, and we owe them a good explanation.
Great, thank you. Well said. So let's turn our attention to a few questions that have come in from our alumni. Here's one that came in from Keith Stack. He'd like to know if either of you can give us an opinion as to the likelihood that a new variant would arise that would require new lockdowns and new vaccines, and any guess as to how long you think this might be before a new variant arises. Dr. Evans, you want to take a first shot at it?
Sure, I'll jump in. Well, I think we have new variants arising every day, and that's the nature of a virus and viral evolution. Some of those become more concerning than others, and thankfully most of them are not consequential, but some of them are. And we've seen over the last months, B117, the P1, and now related to India, this B16172, those variants that appear to be more transmissible, and they may challenge the efficacy or the effectiveness of the vaccines that we have. So I think that we're already into that era. I think our vaccines have held up extremely well with respect to the variants that have emerged of concern, the variants of concern that have emerged. Although in the UK, very concerning data released just last week with respect to the B1617, particularly with respect to the lower protection following a first dose of vaccine. I think that we are already in that era. I think dealing with these moving forward, we can't dissociate this from the discussion we've just had, which is the sooner we get to vaccination coverage globally that has 60, 70, 80% of the population covered, the lower likelihood we're going to see these variants emerge. And so it's not, just to repeat, it's not a function of Canada as an island getting its vaccine coverage to that critical threshold level. It's other countries where the virus will continue to mutate and potentially come back and challenge us on this front. So we're in the era, and vaccine equity becomes, I think, the end game.
Okay, great. Thank you. So Dr. Liu, maybe I'll direct the next two questions to you. I'm going to couple them together because they both speak to this issue of the origins of the virus. So we received a question earlier this week from Philippe Laporte. So I'll read it here. He says, "We are only ready for the next pandemic if those responsible for spreading this virus beyond its initial borders are held to account, right? We don't want to be ready for the next one. We want to make sure it doesn't happen at all. Thus, those who have shown to be irresponsible in handling the situation must be targeted for retraining. Pressure must be mounted at the diplomatic level. Do you agree?" And just now we received a similar question from Roseanne Tom, who is asking for your thoughts on President Biden's calls for investigating the origins of COVID. I know just yesterday he announced a call to redouble efforts to find out how did this virus originate. So perhaps you can address those. I know we talked about it a little bit before we went on air. Why is it so important to get to the origins of the virus?
Yes, this is I would say a touchy topic, the topic on the origin of the virus. But I think it is key to understand where it comes from, because it brings us a whole set of other questions. And if, for example, if we basically have two things that is confronting itself. There's the spillover theory of that is the one that is most likely, I would say, origin that was put forward by the independent panel on investigation on the origin of the virus. But as they said, there's a lower probability coming from a lab, but not excluded. And then when they came back with their finding, the general director of the WHO said, we don't have enough data to come up and to basically brush away the possibility of a lab accident. And so therefore we need a second phase of investigation. So this will happen. We need, everybody understand that we need to know, because if it was a lab, and taking away, all the political issue around that, is the fact that we need absolutely in the future to make sure that this does not happen again. And we need to learn from that. So it can happen, mistake happen. If it's not, then I think that it would even speak even more further on the theory of the spillover, meaning a virus that jumped from animal to human. And I think there's going to be a stronger call as well on how we are living with the different, I would say, ecosystem of the environment, the wildlife, and the human being. And as Tim was alluding at the beginning, is this pressure that we have on our environment that basically push for this spillover of animal virus to human. So it's key. And I was during our conversation before that, in 2010 in Haiti, when there were this massive outbreak of cholera, it was one of the biggest cholera outbreak in modern time, with more than 500,000 cases. Never had a case of cholera before. And it was important to find out what was the origin. And we ended up finding out that it was from the blue helmet coming from Nepal. This is a well-known issue. And then because of that, it created, way of making sure that this doesn't happen again. So the issue is not to blame. The issue is about learning about the origin to prevent this to happen again. And this is why I think we should never be, I would say, against finding the truth.
Mm-hmm. Okay, great. Now, Dr. Evans, on our last webcast that you and I did, I think it was back in December. At the very end, you made a comment alluding to Canada's response and the fact that we have a very decentralized approach where health care is run by and administered by the provinces. I think I was a bit concerned you were about to trigger a constitutional crisis right before the holidays. So I think we just went off air at that point. But I made a note to bring that up again. And in fact, one of the other questions that Amia that he had sent in was specifically asking about whether Canada's federalist healthcare system has been more advantageous or disadvantageous in combating this pandemic, and if the latter, should Canada strive to have a more centralized system in the future? And while we've been on the air, another question has come in from François Labonté, maybe related. He's asking if you can explain Canada's underwhelming performance in managing the pandemic compared to other advanced countries, as reported in a recent study by the Fraser Institute. So I don't know if these are coupled together, but maybe you can speak a little bit to overall Canada's response and whether this notion of us having essentially 13 different plans run by provinces and territories has actually been harmful to our overall response.
Great. Well, it's a great question, and I'm going to defer to constitutional lawyers on this before I say anything. I think this is a ripe, picking up on Joanne's last point, a ripe opportunity for learning. And the first thing I'd say is the thing that unites Canadians across the 13 jurisdictional boundaries for health are Canadians. And I think the greatest asset we've had in managing this pandemic is incredibly high adherence and engagement of the population in respecting public health norms and good behaviors. And we see that in quantitative terms. Following the first wave, we had less than 1% of the population in Canada infected using detecting antibodies in the blood. That's a very, very low rate relative to any country. And that reflected, I think, the fact that the Canadian public really took matters into their own hands and behaved in a way to minimize exposure and did a great job. Having said that, I think that when you look into our jurisdictional collaborative mechanisms, there's a great deal we can learn. The Atlantic provinces have hit it out of the park. They've done a tremendous job, and we have to recognize that there are very few. They join sort of the likes of New Zealand and some of the Southeast Asian countries where they've really managed through good public health measures to keep this epidemic from overwhelming those systems. Similarly, I think our northern territories, including Yukon, Northwest, and Nunavut, have done an extremely good job as well. So it's not, I think it's a mistake to have a single brush painting the experience or characterizing the performance across the jurisdictional boundaries. Having said that, I think there's still lots of areas where we could have done much better. And I think this issue of whether or not we need to have emergency capabilities that would enhance federal powers so that we can move more quickly and can aggregate information more effectively. And I would argue deploy research in a much more progressive and proactive way so that it's part of the solution rather than coming in too late to matter. I think those would be some of the areas where we could revisit this issue of division of labor and perhaps be better prepared for a future pandemic.
Okay, great. So we only have a couple of minutes left. So I have a couple of final questions, one for each of you, let's say. So Dr. Liu, your decision to come to McGill at this moment in your career to focus on pandemic preparedness, I assume, was triggered in large part by COVID-19 and the mistakes that you were witnessing as a physician practitioner. So what sort of work do you hope to accomplish in the coming years? And how is your position, your arrival at McGill, going to enable you to do that even better?
Yeah, thank you very much. What do I hope to accomplish? I think that that is a good question, but I would be presumptuous to just say that I have like a master plan. But I think that humbly, what I would like to be able to do is to contribute to basically putting together some strategic thinking and knowledge towards tackling and responding to a pandemic. And so there would be a part of looking backwards and just say, can we be able to contribute in learning the lesson to be learned, to be in the future standing ready to act? And then what would be in terms of policy and guidance that we can bring together and articulate to make, I would say, to move from thinking to action. And so that's a hard task. But a university like McGill is a great place because it's a university who's been fully engaged in responding to COVID-19. There's so many initiatives, but as well, a university is, I would say, a wealth of diverse knowledge. And I think that we need to create new strategic knowledge by making what I call unparalleled marriage of knowledge together. And then because I think that we've seen it, science can deliver a vaccine in 10 months. What has been the rate limiting factor is the human factor in COVID-19. That's what needs to be fixed. So I hope I'm going to be able to bring some answer to that.
Great. Well, it sounds like you're at the right place to get started and you've got the right partners, including Dr. Evans. So last question for you, Dr. Evans. So one of the interesting developments that I've noticed also during the pandemic, and perhaps a silver lining, is a heightened interest in the fields of science and medicine, particularly among younger people. In fact, a report I saw recently suggested that applications to medical schools are up 17% over a year ago. So I guess my question to you, as you know, putting on your McGill hat at the School of Population and Global Health, is McGill ready to welcome a new generation of young students eager to work on the front lines of the next pandemic? And do you welcome this new interest in science and global health?
I think it's perhaps one of the silver linings of the current crisis, which is this is an area where students looking forward recognize that there's no shortage of opportunity to make a contribution in this space, in part because of our inadequacies in dealing with the current situation. So I think that's remarkably positive for us. I think, however, we need to not make any assumptions that the supply of what we offer is what's needed. And this relates to the way we manage our education programs or the way in which we think about conducting our research. I think we have to hold ourselves up to the same degree of scrutiny as our public health agencies and others that are going to go under the microscope in the aftermath of this pandemic, and ask ourselves whether we're stepping up like we should. An important part of that, I think, is recognizing and understanding the demand from that next generation of leaders. And so when they indicate an interest in science, in medicine, in public health, and epidemiology, we really have to ask the questions whether our programs are fit for purpose and how we can make them perhaps more fit for purpose, such that we're really providing the springboard for those students to enter the workforce and make contributions a little bit like Joanne has made in her career, and which I think are such an inspiration for all of us.
Great, great. Well, wonderful. Thank you for that answer. So unfortunately, that about wraps up the time we have today. And apologies to all of the viewers who did send in questions. We've got so many questions that I was just not able to get to today, but we'll definitely maybe have to pick up this conversation at another time. Before we close, I'd like to remind everyone that this video will be available at this very same link soon after our recording ends. So feel free to share it with others who may not have been able to tune in live. And of course, I'd like to extend my deepest gratitude to our two exceptional panelists today, Doctors Tim Evans and Joanne Liu, for joining us and offering such insightful responses to many, many questions that we threw at them. And once again, a big warm McGill welcome to you, Dr. Liu, on your joining the team in the School of Population and Global Health. Please stay tuned to your McGill email and social media feeds throughout the summer for more updates as we continue to provide you with insight and information from our McGill experts on the pandemic, its effects, and the many other challenges that we face. Until then, please continue to stay safe and be well. Thank you.
Thanks for having us, Derek.
Thank you so much.